I'm Madison Rodriguez, and this is The Invisible Voice. Earlier this month, Trump signed a sweeping new spending law that's set to cut more than $1 trillion from Medicaid over the next decade. Most of the public conversation has been surrounding the healthcare-related consequences to these cuts, but what a lot of people don't know is that Medicaid also plays a vital role in public schools. Medicaid isn't only used in hospitals and other medical settings. It's one of the largest funding sources for in-school health and disability services. This includes, but is not limited to, school nursing, mental health support, behavioral crisis response, therapy, and evaluations that help students get the services they need in order to learn. While these cuts target disabled students most directly, the ripple effect will impact every student. When schools lose important personnel like nurses, therapists, and counselors, everyone loses support. For more clarity on how slashing Medicaid will impact public schools, I spoke with Casey Doherty, disability policy analyst for the Center for American Progress. Casey is currently earning her doctorate in special education and disability studies.
Medicaid plays an undeniably vital role in schools. Medicaid supports approximately $7.5 billion in K-12 health services annually. That makes it the fourth largest funding stream for K-12 public schools. So, huge deal. I think a lot of people maybe don't know that. It's absolutely essential for school-based health services. Without it, schools couldn't provide health and disability services at the scale required.
While that number gives us a sense of the scale we're working with, it's also important to remember that the impact isn't just financial, it's personal.
I think sometimes policy can feel so esoteric and broad and this big concept, but when you really boil it down, it's like these children.
The services that are at stake with Medicaid cuts help schools comply with federal disability rights laws like IDEA and Section 504. Without Medicaid, school districts will have to make impossible choices, and some may not be able to meet their legal obligations. This isn't just a problem for disabled students, but for public education in its entirety.
Students have the legal right to receive a free and appropriate public education in the least restrictive environment possible, where they're educated alongside their non-disabled peers. And some students need accommodations and supports to receive that free and appropriate public education, and that's their right.
School districts have long faced financial challenges when it comes to special education. When the Individuals with Disabilities Education Act, or IDEA, was passed in 1975, Congress pledged to cover 40% of the extra costs for educating students with disabilities. But as of today, the federal government only provides about 12 to 13%, leaving a national shortfall of over $38 billion. Because of this chronic underfunding, many districts rely heavily on Medicaid to help cover the costs of services that IDEA requires.
School districts are extremely dependent on Medicaid to meet IDEA obligations. IDEA has never been fully funded, 12 to 13% is where we're at, when it's supposed to be 40% of the excess cost. So that's horrifying. Medicaid helps districts fill that gap. Medicaid funding is what keeps many of these services functional and available in public schools.
Medicaid funding is more than just a line item in a budget. It's a fundamental requirement that school districts rely on to meet federal laws and provide necessary services to students.
Medicaid funding in schools is not a luxury or an add-on or an afterthought. It's literally how schools meet legal obligations under disability civil rights laws. Without Medicaid, districts either violate federal disability law or they're absorbing unsustainable costs. School districts aren't the bad guy. They may be forced to make horrible decisions, and it's not their fault. I think a lot of the time they are trying to do the best for their students.
At the very same time that schools are being asked to do more with less, the systems meant to enforce these civil rights are being dismantled. Adding pressure to this already impossible situation, the Federal Office for Civil Rights, which is the agency responsible for enforcing these protections, is essentially being gutted. 7 of its 12 offices have been closed under the Trump administration, and over the last few months, over 3,400 complaints have been dismissed. With oversight disappearing and legal remedies harder to access, families are left with very little support. School districts are pushed towards violating federal law, and attorneys are left navigating a system where the law exists on paper, but the mechanisms to uphold it have vanished. What emerges is not just a financial crisis, but a full-blown accountability vacuum, one that puts disabled students and their civil rights in the crosshairs. When schools lose these services and families lose ways to fight back, Who's left to ensure that students are having their civil rights met?
It will be interesting to see courts potentially having to consider whether federal funding decisions can justify a school's inability to meet legal obligations. What precedent would they rely on? And would it be considered like the school district's fault for removing services, or would it be considered the federal government's fault?
These changes are not just theorized or hypothetical. Many schools across the country are bracing for what's coming. According to a recent study conducted by the Healthy Schools campaign, 86% of school staff said their districts use Medicaid to pay health personnel. Over half said they rely on it for mental and behavioral health services, and nearly half use it to fund assistive technology and specialized equipment. Many anticipated layoffs and service cuts if that funding disappears, especially for supports that disabled students need to stay in general education classrooms.
Roles like school nurses, occupational therapists, behavioral health support staff, these staff members very much can help make inclusive education possible. And without Medicaid, their jobs are at risk. And if these roles disappear, students with disabilities may be forced out of general education, inclusive settings entirely. They may be then segregated, removed from their peers. Like you think about maybe a student has seizures during the day and needs a support staff with them. But if that support staff is no longer there, can they go to school at all?
This isn't just about staffing. This is about what kind of education disabled students are allowed to have, or if they can even remain in schools at all.
Disabled students will bear the burden of this unless policymakers do something different and act to restore the funding and preserve students' civil rights.
There's still time to act. These cuts don't take effect until 2027, giving activists a narrow but critical window to speak out and push back.
Personal stories from students, families, and educators, I think, are universally the most compelling, connecting the dots that Medicaid cuts equals cuts to services equals civil rights violations. If you're comfortable and have the capacity sharing your story, especially if school services helped you or your child thrive, I think that's really important, and we're seeing that messaging, work and change people's minds. Medicaid cuts are universally disliked by the American public. So, when people have the information, they form opinions about it, and they can be swayed by, those personal stories. Continue to call or write or contact your representatives stating how these cuts will hurt your community or you or your family. Just because a law was passed doesn't mean that we need to be quiet or stop our advocacy. Investing in that local community, in your school district community, and sharing with those officials at the local level, that it's so important and these services are not optional. Again, I absolutely do not think school districts are the bad guy, but I think starting that communication early to make sure that the advocacy continues there on the local level and school districts know that you're paying attention, I think that's very important.
As advocates push back against these devastating cuts, there's a broader challenge at hand. Even before this bill became law, the system wasn't working the way it should. Disability rights laws have long outpaced the funding and infrastructure needed to enforce them. The danger now isn't just that we lose what we've gained, it's that we lower our expectations entirely. Holding the line is essential, but so is continuing to push for a better system that actually meets the needs it was designed to serve.
We have to think about how can we try to come back from this, on a systemic level. So I think demanding full IDEA funding, thinking beyond preserving Medicaid, considering a long overdue investment in special education and services for disabled students. Do I think that that's going to happen tomorrow? Absolutely not. But I think that longer term advocacy is important.
Because what's at stake isn't just money. It's the future of inclusive education and the right of every child to learn and thrive in their own school.
School-based Medicaid funding has just long been the plan, part of the program. And so stripping it away is, I would say, fiscally reckless, legally wrong, and morally bankrupt.
Federal law promises every child the right to a free and appropriate education. Whether that promise is actually kept may depend on how we, as a nation, respond. Reporting for The Invisible Voice, I'm Madison Rodriguez. Thank you for watching.